Mahara colony in Bhiwandi is a crowded slum in Mumbai, India. It is home to about 20,000 people, many of them victims of flood disasters from across the region. Towering and closely built 45 blocks with 8 floors that accommodate about 24 families each mirror the crowded nature of the settlement. A walk round Mahara colony and one thing will strike you: the dingy nature of the environment. And of course, living in such poor sanitary condition has health implications. And one relief the low-income earners in this community have is an organization called Doctors for You. The filthy environment is the least of the worries of residents as they carry on rather oblivious of it. Access to clean water is also a challenge and responsible for many ailments.
There are a lot of tankers that come here to fill up the water in the tanks which are on top of the buildings. The problem is that although the water is clean, the tanks are filthy. The pipelines in the entire colony are filthy, and there have been times when the water has been green in color. So, just by looking at that water, you can understand that whatever your malaria, every disease that's caused by stagnant water is because of the water that comes here.
Five-year-old Rehan is battling with another health problem prominent in the slum: tuberculosis. Medical doctors with a non-profit initiative, Doctors for You, are helping him survive the deadly TB infection. His grandfather wasn't so lucky as the sickness took his life. After his demise, the clinic carried out a test on the family. They were all free except Rehan.
Since he's a category 1 TB patient and since he's a very young child, I don't think that he is going to have much difficulty because his mother is taking really good care of him, and our center provides with the DOTS program, and so they don't need to go anywhere outside for his treatment. So I think he'll make a full recovery soon.
Rehan, his sister Aisha, mother Rukaya, and grandmother Mirambi can be considered privileged because their room has a toilet and bathroom attached to it. Some of their neighbors with families twice and thrice their size share a room and toilet facilities. TB medical experts say spread quickly in crowded environment. According to the clinic, they currently have 95 cases of TB with 5% children.
There have been cases of neighbors getting TB because they mingle with the family around them and their neighbors and things of that sort. But then, somehow they're able to prevent it because there's this one case who ensures, her mother ensures that all the utensils or everything that TB patient uses is completely separate from the rest of the family. So they do whatever they can do within that small space that they have.
Rehan's 26-year-old mother is the breadwinner with a miserly wage of 1,500 rupees, about $28 and 4,400 naira as a domestic worker monthly. She says the free medical care and drugs from the Doctors for You clinic has taken a huge burden off her shoulders. The doctors are very helpful. They even come to see us at home. I am very happy, she noted. Rukaya says many necessary bills gulp her meager salary: 600 rupees for electricity and 300 as sanitation fee for the rather dirty colony. To make ends meet, she also does menial jobs that fetch her an additional 200 rupees. Non-profit foundations like the Doctors for You are lifesavers for many like her in India. Like their slogan that says, "There to care for you," the clinic operates 3 times a week in the colony from 9 a.m. to 6 p.m. with just 2 doctors attending to about 70 patients, mostly young health workers between the ages of 25 and 30 years. Some in the settlements refuse their services just because it's free. According to one of the volunteer counselors, they believe since it's at no cost, the healthcare quality could be of poor standard. There is also the issue of bias for gender.
There are some families who have issues with this. They have the stereotype, that male should not touch them. So it's like there's some female, they have a problem when they come here to the health center. They say that there's a male doctor. We are not okay with it. But most of them, they don't have issues. They're like, if there's a doctor, whether male or female, if he checks it, that is like okay with them.
Rukaya and her family, however, hold the free clinic in high esteem, especially knowing little Rehan will not likely join his grandfather 6 feet below now. Happy Rehan, on the other hand, has no clue of his health condition, efforts to save his life, and the many challenges of his family and neighborhood. One thing this agile child knows for sure is playtime with his little sister and neighbors. He is indeed a reflection of grassroots healthcare and follow-up.